Hello, this is Dr. Sima Aiden. Today's video is about safety issues of GLP-1 receptor agonist medications such as semaglutide, correct? Because again, I think I thought about having this topic because we talk a lot about how great semaglutide or Ozempic is, but we don't hear as much about the safety issues. And I got this information from National Library of Medicine. And this is a paper that has the meta-analysis, meaning that it gives me the bottom line of the basic safety issue that has come up from all the studies and trials that has been done on the GLP-1 type of medications, correct? So they kind of summarize it for us and make it easy to understand. So the very common side effect of this type of medication is digestive system related disturbances. And one reason for it actually is because it slows down the gastric emptying time. So it makes sense that when things are not moving, we feel like bloated, gassy, indigestion, that we are not comfortable there. We cannot, digest food properly, constipation, diarrhea, and nausea and vomiting. And these are the very common side effects in the studies and also in the real life patient scenarios. And some of the side effects, we know the reason for it. Some of them, like nausea, vomiting, and diarrhea, they don't know the exact side effect to it. They compared the incidence of side effects when they compared the semaglutide oral versus semaglutide subcutaneous. It was the same, even though when they used the semaglutide oral, the dose was 20 milligram, much higher than the traditional 7 to 14 milligram. The side effect of the GI disturbances was the same. And the side effect of the GI problem usually happens in the first 8 to 12 weeks. And then after that, it should level off. And one of the factors that can make the side effects really bad is that if we go high on the dosage too quickly, too fast. And that can result in really serious side effects that could be really not tolerable and could be one of the reasons that patients stop taking semaglutide. So it's very important. The first reason that's so important to go slowly. And plus the fact that in my practice, I have patients that we realize that the low dosage are enough for them to lose the weight with the rate that is safe and is acceptable for the patients. So, but at the same time, the side effects of the semaglutide that's related to the digestive system is a blessing, because when we feel a little bit nauseous, especially in the beginning, when the pathways in the brain, because it also affects the brain, the hunger and satiety signals, in the beginning, we might still have our old routines and habits of wanting to eat. So when we are nauseous, it's like a break for us not to eat. When we are indigested, we don't want to eat, obviously, correct? So it's like a break to reduce the amount of the calorie that we are taking. Also, in general, it doesn't matter how long you are on semaglutide. I've been on it for it's going to be close to 2 years actually, is that still I cannot overindulge, especially with things that are fried and fatty and heavy. Again, it's another kind of a break on my system that makes sure you don't overeat because you're going to feel sick. So this is the digestive related issues or the basically adverse effect. Another safety concern was, could semaglutide cause low blood sugar or hypoglycemia? And it shouldn't, based on the studies, unless patients are on other anti-diabetic medications such as insulin, for instance. Then together it could cause that. But it hasn't been an issue in the clinical studies. And also the risk of the hypoglycemia basically for the combination is something that needs to be really watched closely. That is why I think having those glucose monitoring devices is very helpful, right? So another side effect is basically effect on the kidneys. It was interesting because in the very beginning that I was just working with semaglutide, I thought that maybe because it mainly goes metabolized in the kidneys, maybe it's going to have adverse effect on the kidneys, but it doesn't. It can cause acute kidney injury, and then they found it in the clinical trials, and it's because of the side effects. For instance, if patients, they get dehydrated, if they have diarrhea, if they have too much vomiting, you know what I mean? It can be a heavy weight on the kidneys and cause acute kidney injuries. And usually such severe nausea, vomiting, dehydration again happens when we are not dosing it properly, correct? So that's a dosing issue. But in the long run, if it's done correctly, actually it's protective for the kidney, because again, on the clinical studies, when they've done it, they realize that usually diabetic patients, because the clinical trial, like SUSTAIN trial, for instance, the participants were diabetic patients, and they already have problems with the kidneys because of the high blood sugar. And it was a plus. It was a beneficial effect on the kidney using the GLP-1 receptor agonist, because it decreased the blood sugar. So as far as protection of the kidney, if it's done correctly, actually it is a plus for the semaglutide and kidney. And then pancreatic adverse events like pancreatic cancer and pancreatitis. So what happens is that always the issue, because again, one of the other mechanism of GLP-1 receptor agonist is they stimulate the pancreas to make insulin. So the question comes, is it safe over the course of long run on the pancreas? And what happens is that still, still the concern is there, you know what I mean, though, but it's very interesting. In SUSTAIN 6 trial, the acute pancreatitis happened in 9 semaglutide-treated patients and 12 placebo-treated patients. It was less in the treatment. And pancreatic cancer happened in 1 treatment versus 4 in placebo. It was less in placebo. In the treatment group. Both acute pancreatitis and pancreatic cancer was less. But still, basically, the pancreatic adverse events at the bottom line, when it comes to the risk factors and also adverse effect and safety issue and with the semaglutide and pancreas, this is the bottom line, is that although pancreatic adverse events are difficult to completely rule out, and as assessment by the FDA and EMA concluded that a causal association between incretin-based drugs like GLP-1 agonists and pancreatitis or pancreatic cancer is inconsistent with the current data. So that is the bottom line. But still, it is important to go slow and steady. Okay. Thyroid cancer. Both formulation, meaning oral and subcutaneous, they have received an official box warning for thyroid C cell tumors in the US. But there are many buts here. This caution is solely based on data from rodent studies and is not unique for semaglutide amongst the GLP-1 receptor agonists, correct? So it wasn't, this association, it hasn't been seen in humans, but in rodents. Also, it's very important is that though they had the observational studies in monkeys that they treated with 60 times more of the human dosage of Victoza they use in monkeys, 16 times more of the dose that they would give it to humans. And they did not develop C-cell abnormalities after 20 months. But the trick here is another but. The trick here is that the MTC, this type of the modulated thyroid carcinoma, is a very rare thyroid cancer. The estimated incidence is 0.2 cases per 100,000 patients per year. So it's very rare. So we don't have enough number of people to really have a solid association between this medication in human and also thyroid cancer. Yet we have to have enough of the data still. But again, in the meanwhile, semaglutide is contraindicated in patients with a personal or family history of medullary thyroid cancer, as well as in patients with the multiple endocrine neoplasm type 2 in the US. So again, so many of these precautions are because of lack of solid evidence, correct? It's better to be safe than sorry. Gallbladder issue is that, GLP-1 agonist, it can increase the risk of gallbladder situations such as inflammation of the gallbladder and gallstone. Especially, there are two mechanisms for it. One mechanism could be if, again, dosing matters in this situation. If the patient loses weight too fast, and too quick and too fast, that can affect the gallbladder. Another reason that it could affect it because it can slow down the function of the gallbladder also. That's why the chance that the bile could get stagnant and sludges could accumulate and become stone is there, But again, it is very, very important that we go up on the dosage very slowly, correct? And a cardiovascular, GLP-1 agonist can increase the risk of the heart rate in average by 2.75 beats per minute. So what does it mean? Usually, when they increase in the large epidemiological studies, they found that increase in 5 beats per minute in heart rate is associated with an increase of 17% in mortality. But it is unclear whether this association holds true for drug-induced heart rate acceleration. So with semaglutide, there are two issues. First of all, it has raised 2.75. It hasn't raised the average to 5 beats per minute. And second, they really don't know the association between the increase in the heart rate and the mortality. We can also have those from drugs if drugs can do that, correct? So basically the last safety issue is the reaction in the injection site, correct? So every subcutaneous injection could have injection site reactions, correct? But they didn't see any signals that was higher in the semaglutide group compared to placebo. But given the immunologic potential of the protein-based drugs, it is important to monitor allergic reaction with the GLP-1 receptor agonist. So again, another area that us as professionals and physicians, we have to be careful when we are managing semaglutide. Yeah. I hope, again, this was a very objective information that I have found through the studies. And again, as usual, is not as clear-cut or black and white. And again, if you have more questions, please reach out to me. I'd be more than happy to answer your questions. Thank you and have a great day.